Here we are. All right. Welcome to Coming Out with Cannabis with your hosts, Christina DiArcangelo Pooler and Wayne Kelly. Today we're talking to Melonie Kotchey. She's the CEO and co-founder of Compassionate Certification Centers. Many folks are familiar with Compassionate Certification Centers. We're excited about the research stuff we're about to do with you, and we'll get to that. But first, CDP!
Good morning, all. The sun is shining in Pennsylvania. It's a glorious day today. We don't often get sun here. And we have Melonie on, and I wore pink today on behalf of CCC because we just love you guys and all the work you are all doing and the partnerships and everything that's going on with you guys. So, Mel, thanks so much for joining us today, and welcome.
Christina, thank you so much, Wayne, for having me on your show today. I really appreciate the opportunity, and I'm happy it is sunny here. That's not often we get to in Pittsburgh.
Well, and you're enjoying it outside on your porch, which is really nice.
I am. I'm at home right now, just speaking to you folks about the medical cannabis program and everything we have going on today. I'm really excited to be here. Thank you.
Cool. Well, we're just going to get started. Melonie, we want you to talk about some of the research stuff you're doing, maybe the locations that CCC has. How can patients get in touch with you? You know, we have all these research projects going on. Christina mentioned several in our pre-call. So, yeah, let's get to it. And CDP, I'll let you kind of lead this conversation because we also want to touch base on, you know, women in cannabis. What is it like to be a female entrepreneur in this industry? So I'm going to sit back here and keep an eye on you guys.
We're going to give you a hard time, aren't we?
Yeah, this will be fun.
I'm just playing. Oh, Bruce says pay attention, so all right. Get my coffee.
So Mel, kick it off for us. Tell us a little bit about yourself, why you got into the industry, and let's hear about CCC. You know, what's going on with you guys, because you guys had a killer year last year.
Thanks, Christina. I just love talking to you because you always fill me with energy.
Oh, thank you so much.
I'll be honest with you, I'm a hardworking farm girl. I was raised on a farm. I was told by my parents if I ever did drugs or got pregnant, I would be killed.
Yeah.
To this day, I am not pregnant and have not had children, and I've never done drugs. I did, however, get my medical card about 7 years ago as a patient in Arizona, where I live. This is actually one of the reasons that Dr. Brian Donner and I started Compassionate Certification Centers. We were interested in becoming involved in medical cannabis, and to this day, Dr. Donner says that he's a better doctor today than he was before we met and before we started with medical cannabis. Our vision was to create a healthcare system, not just clinics, not just pop-up tents where doctors rubber stamp certifications, but a true medical healthcare system where patients can come in unjudged freely and feel the way I felt when I got a chance to finally find a physician who understood how to speak to me about medical cannabis. So that's really where I come from with the industry as both an investor, a patient, and now the founder of this company with Dr. Donner.
That's fantastic. And I have to say, you know, as you know, both Wayne and myself were patients in Pennsylvania, and, you know, CCC is our clinic of choice, Dr. Donner specifically. I think Wayne may have seen Dr. Patel too, who we equally love. We love all the physicians at CCC, but one of the things that I love about you guys is the fact that you truly understand what the patients are going through. A lot of these patients, especially with all the qualifying conditions we have here in Pennsylvania, they're not drop in the bucket, qualifying conditions. I mean, they're pretty serious medical conditions these patients have. And you see people from autism to epilepsy to cachexia to palliative care for cancer, to neuropathy, various, all over the place. And you guys have to make sure you're staying on top of the literature and how to treat these patients, because now you're becoming a generalist, so to speak, on all these acute care indications that you have to treat.
Christina, that's absolutely right. I would never go to a cardiologist to have a baby.
Right.
Why would you do that?
Yeah.
Why would you go to a primary care physician to get your medical card? Well, perhaps some of them do know a bit more. But overall, if you look at the 33 legalized states, the majority of the physicians that do the certifications will only do them for their own patients. Oftentimes that's oncology. And the rest, it's kind of a hodgepodge mixture. Most states have less than 1,000 doctors that do the certifications, and that's been more than adequate. So I feel that Pennsylvania has plenty of physicians to do the certifications, and we truly, really do have great doctors. We're a little picky about who we bring on board, but the doctors, I have to smile about this because we just had another doctor ask to quit his full-time job and work for us full-time.
Oh,
I got an email yesterday from another doctor who's moving who said this was the best career he's ever had in 25 years as an emergency room doctor.
And you can see this. You can see this when you're working with these physicians, you know, because we're fortunate enough, not only do we have Affinity Bio Partners and Cannabis that we work with you guys on, but then Dr. Donner, you know where I'm going, Mel, he helps us with APA, right? Affinity Patient Advocacy. So a lot of times Dr. Donner and I will join in to a group like the kid that was in the summertime, stage 4 at CHOP, and his mom wanted to get him CBD. He needed a card. She needed to become a caregiver. She had heard about some secret recipe on the West Coast for cancer that was like an RSO that Dr. Donner and I knew about, and we're like, no. We don't, there's no clinical trials to support this. So right now it's hearsay, and we can't stand behind hearsay. So I'm fortunate enough, and I know Wayne too, we're fortunate enough to see you guys not only in the patient everyday care aspect, but then the advocacy side, which I think is so important for patients out there to know that you guys are in it to win it. Yes, you have to pay your bills. Yes, you have to pay for your staff. Sure, we all have to pay our bills and make our money. However, we're here for the patients. That's why we're here.
Christina, I couldn't agree with you more. And the foundation of our company really does begin with the way that we treat our patients. And that starts from the time that we answer the phone to the time they leave our office to our follow-up visits and our recertifications. One of the reasons that we're doing so many medical certifications is because ultimately our heart lies in research.
Right.
Research is what you're doing at Affinity Bio. Right. We just love, because I've been involved in research for 21 years, roughly. I got UPMC a very nice sizable research grant for cholesterol, for example. Well, the time that it took me to do that was years, millions of dollars, and lots of red tape. And I understand some portions of research. However, what I love about what we're doing is that it's private.
Right.
We can do it much faster.
Right.
With good results. We can do good retrospective analysis. And what that means for us is that more patients have access to medical care, and they'll actually be able to know what dose to take and how much a day. And they sound like simple things, but they're not. As a patient,
No, it's not. It's not simple, because the dosing protocol is not substantial in this industry, right? Not everybody understands it. Patients are underdosed, or sometimes they take too much. Obviously, then they have a serious adverse event, not hospitalization necessarily, but laid out on the couch, and some issue. But I think the research aspect, I agree, is so important, because if we want this to be a medicine, because that's what we want, whether it's CBD or medical cannabis, a derivative of, which I'm not talking about flower, I'm talking more like the RSO or tincture-based, CBD with THC. If we want this to be medicine, we have to put the time in and do the research, because there's a lot of anecdotal evidence out there. You guys are seeing it with your patients. You saw, 50,000 patients, right, Mel? Was it 50,000?
That's right. We have over 51,000 patients. And that's either registered in our database, meaning with an ID ready to become a patient, or that we've seen, or that are active, or that need recertified. But out of 102,000, I believe, registered in Pennsylvania, we have over 51,000 in our database now, which is exciting, because we saw our first patient December 8th of 2017. And he's a blind veteran. He waited 2 hours. He didn't have access to the computer, and that's one of the things that we love to do is some of the veterans events.
Right.
Different groups, but I also don't like to get down the rabbit hole of just picking certain groups and accommodating. Because when you do that, I'd love to accommodate everybody. Whether you're a child, or you have autism, or ADHD, or cancer. To me, everybody is suffering and has a different problem or issue, or serving our country, of course, is one of the awareness.
Right.
Back, but that's certainly what we're trying to do here.
Right. And go ahead.
Oh, okay. Oh, good. I'm trying to let you go. I don't want to interrupt, but in our conversation, that's what I mentioned. I do appreciate that about CCC, the aspect about reaching out to our veterans. We did communicate with a couple of veterans here on our show, and they are so appreciative about the medical marijuana program in Pennsylvania. But some of the things you were talking about, the healthcare system, your idea about creating a healthcare system that just falls in line exactly about some of the things we talk about, because data is everything. Without data, all you have is an opinion, and I'm just paraphrasing a quote from somebody else. But so that's the backbone of data research, of clinical research, is the data that will get from that. So it is exciting for me to be part of this and be the back end data guy to be able to see all that. So exciting stuff. Research is what we need, and the partnership is amazing. I just want to give
and one of the things I think that's so fantastic is that we've all come from different walks of life, from different industries, right? So, whether it was healthcare, biotech, pharma, traditional CRO, advocacy, all the different variations, we've all come to the table with our skill sets, and we're helping, I feel, bring the industry up a level, because there's a lot of people that think they can just jump in here for their green rush train ride, which we all know there is no green rush for those that are professional like us. It's laughable, actually. But I think it's fantastic, because the things we learned previously we're bringing forward. We're not trying to red tape the industry up with a bunch of regulations and craziness like working in our past lives, but we're trying to set the bar,
Right.
and like having a relationship with intake review, right, as our IRB. You guys saw how quick the review came across for the one protocol we did last year with you guys in CBD. It was a quick, efficient process, because we made sure that we reached out to them in advance and said, hey, are you going to review these protocols? Do you have a problem with this? Because of the whole stigma situation. So you got to make sure we lay that foundation from the rip. Otherwise, it's going to delay things.
Yeah.
That's what's so nice about having a partner who understands the cannabis industry like you. That's almost impossible to find, because together we can quickly ascertain what we need to do, what priorities we need to make in order to get these research trials going and execute quickly on them, because we need the results. There's people out of time, and I understand what you mean. We want to treat medicine like medicine, and it's, right now we're just not there yet.
No, not yet. Not yet.
Well, we all have such a great opportunity here. All of us coming from traditional healthcare and creating a new system. Traditional is already broke. They're using legacy systems that collect data in a very passive, aggressive manner, by paper, by clipboard. It's very difficult to get the information that you need. Here in this new industry that you guys are creating, or have the vision to create, we have the opportunity to use the best technology, the best protocols, to collect the right research for our patients. And just once we have that data, the sky is the limit. Using the best technology to achieve the greatest data is our opportunity in this industry together. So fun stuff.
Far too many decisions are made in this industry without data.
Exactly.
I'm not a guesser. I hate guessing, but a lot of times we have to, in terms of marketing and questioning, what are people going to need? What research do we want to do? And what retrospective analysis can we already come up with? For example, the fact that we have 7,000 patients that potentially could be off opioids right now. So you can look at that and bringing it to the stage really brings value, and that's what I think our organizations are going to do moving forward. And it's really exciting that both female, organizations, less than 25 women in the top 500 Fortune 500 are women. So I'm proud to be a woman in this industry, and I think women and men, they think differently. So we just have to adjust a little bit. I find that when I go to a meeting, most women are overly prepared, because we have to be. And that's just a part of the exciting thing that I think that we have together, Compassionate and Bio, Christina, is that that we can bring data-derived decisions to a market and change the medical healthcare system of the United States with what we're going to do.
I'm really excited with that, and especially since both of our organizations sit on the board for the American Society of Cannabis Medicine. I was talking to Doug Benz yesterday about all the research that ASCM wants to sponsor, which is huge because then that means that BioPartners leads it, and we're able to work with CCC and other physicians, depending upon what the product is. If it's CBD, obviously it's easy for us to do a study because we can send that all over the place, right? We're not handcuffed to, doing a study in Pennsylvania, just in Pennsylvania for a specific indication because we're using a product that's backed by a Pennsylvania company like Ilera, for example, because we can't ship that over state lines.
Right.
So that's the exciting thing that I'm really looking forward to is that, the ASCM wants to produce clinical research to show the validity of this industry. These are all pharma individuals that have come together, and healthcare guys, VCs, all different walks of life, lobbyists. I'm really excited about this opportunity for us because we're really going to be paving the way. And we're working on a bill in DC to be able to deschedule for research purposes, which is huge for us because once those cups come off, the sky's the limit for us.
Oh, yeah.
Yeah, it really is. I know how cuffed we are when we can't ship across state lines. And it's difficult, but that is an amazing organization. And to your point, we're aligning ourselves with industry professionals, yet breaking barriers.
Right.
Fine line between being flexible yet rigid, bringing the old to the new. Because I come from pharma and biotech myself,
right.
Early 2000s, and I have this corporate culture and this sense about me that I'm still trying to shed some of it, but yet I'm still trying to put some of it in. I can't quite explain that.
Yeah. Well, you know what? You have to be more relaxed, right? Because a lot of times we're suited up in the corporate side, and certain events we go to, like patient events, I have started dressing down, which is big for me because we've been corporate for so long. When you represent your company, your brand, and who you are, you suit up. That's how I was raised, you dress
self-recruited.
And so, we had this event with the veterans in Allentown about a month ago that we were speaking at, and I wore jeans. That was the first time I wore jeans to a patient event ever.
It reminds me, I'm a quote guy, Melanie. You may have already identified with that, but what we're talking about, we all learn this pseudo corporate environment strategy while we were in traditional. And I'm reminded of, I think it was Einstein that said, education begins after you forget everything you learned in school. And I think we are being educated now because we're learning we're forgetting all that stuff that we learned in big corporate traditional, and putting on some new hats, trying on some new clothes, but remembering some of the things that make sense about our experience in traditional healthcare. So it's exciting, it's fun, and again, I apologize. When things come into my mind like those quotes and stuff, Steve will tell you I live on that kind of stuff, man.
You do. It's a great analogy, though. It really is.
And I think too, in the cannabis industry, we actually get to interact with patients more so than we did on the traditional biotech pharma healthcare sector side, which I feel like it helps them even more because we are hearing what they're saying. We are listening to them. If they're giving feedback and they're explaining whatever it was that happened with this product, that product, or how it made them feel, etc., we're listening to them and they feel validated. There was a patient that came across that you guys are actually working with. It's a caregiver. It's a mom who has 2 autistic kids herself.
Yep.
And she's a caregiver.
I read her name.
Yes. And she's a caregiver for other autism patients. She came to us through her husband, through Wayne, because Wayne's daughter knew the husband, and they had an adverse experience with one of the patients she was caregiving. at a dispensary in State College where the kid went in. He's autistic and Asperger's. My nephew is Asperger, so I understand this implicitly.
Right.
You know, my nephew is now 17, so you know it's been a long time. And so anyway, this poor kid goes into the dispensary and he's given 2 vapes, 2 pods, and they send him on his way. And there's a sign there that says, "Keep your children under control," in the dispensary. And so he was very upset about this. He was upset that they didn't explain the product to him. He's autistic with Asperger, very spectrum. And so you have to take the time, right, to help these patients. You just can't go, okay, cha-ching, cha-ching, and out the door they go. So here, you know, the caregiver comes to us and,
well, Keandra couldn't go in with him because
she wasn't a caregiver.
She isn't a licensed MFJ caregiver. She's an autistic. She works with a team of autistic patients. So he had to go in himself, you know, through the pharmacist interview, you know, and this poor guy. Anyway, yeah, I had her name down here too. I wanted to thank CCC for working with us through that effort, because Harley is the husband name. I knew Harley since he and my oldest daughter worked at Starbucks maybe a decade ago. He reached out to me because he sees the stuff that we're doing together in medical cannabis. And Harley, if you watch this, thanks for hooking me up all those years at Starbucks. But we're, you know, because he did. But we're going to see what we can do for Keandra and your children. But thank you.
Yeah, it was a fantastic, you know, because it was they contacted us and we just immediately went to action. Like, okay, we're going to contact CCC. We're going to get you a caregiver card. We're going to get your kid diagnosed because the one child wasn't diagnosed autistic. So we have to get that child diagnosed, then get that child a card, you know, the whole process. So CCC's working on all that with us. And then we're also, and Blaze, we love Blaze. We interact with Blaze, I swear to you, on the daily. I'm sending him an email about some patient that we're working with you guys with. He's just fantastic. And, you know, we got the most lovely email from them. Thank you so much. The young boy feels supported because Kendria went back and said, look, Christina and Wayne and CCC, they've got your back. They're going to help you. Don't worry. This will never happen to you again. We'll make sure of it. You know, and that's why we do this, right? Is to help these multiple patients, especially, I'm getting upset, this poor kid, you know, it's just very sad. So I'm glad that we can come together and help these patients.
Me too. And Blaze actually helped me. He's one of the people that got me on CBD because I had given up hope myself.
Me too. He helped me too.
Amazing. So I thank you for bringing that up, and thank you for sharing Harley, the story, and all these people that need help. There just isn't enough time or hours in the day, but we certainly are on board with the caregivers, and it is difficult to go into a dispensary. You never know what you're going to hear or get. You know, my own personal first experience here was terrible.
Mine too.
It really was. I actually would say, you're the CEO of CCC, you're rich. Why are you here buying medicine? And I was appalled by that. I'm not rich. Yeah, you know, it takes years to make money at this job, especially as an entrepreneur. You know, I put my life savings into this, and then to go get your own medicine at a pharmacy, which I shouldn't call it that, I mean a dispensary, but it's the same. So we're going to keep making things better. I know that we will.
We can do better.
And even so, I'm still grateful that we even have a dispensary to go to. So I'm just going to keep staying positive. It's on the learning curve that we're on.
Well, and we're doing that big survey, right? That's coming up across all the patients that are within the CCC organization, where we're going to do a check-in. How are they doing in the PAMMJ program? What's their feedback on the dispensaries, the pharmacists, the physicians? Just so that way we can learn, you know, the advocacy side of things, insurance claims, all those things we're looking at, because we want to really see how this program's working, because we're hearing things. We're all patients, obviously, too. We're seeing stuff firsthand, and there needs to be some minor revisions that we already know about.
So we're going to get you that feedback with those questions. We have a high touch sales technique that we use with our CBD patients.
Nice.
And I hate to use the word sales, but you actually do have to convince a lot of people that it needs to be taken like a multivitamin.
Right.
Our CBD brand, we introduce that to people. It is very low price, but the point is that we're really trying to get people to embrace and open up their endocannabinoid system, whether they get a medical card or not,
right,
research trial or not, and then come up with those great questions, those socioeconomic, demographic ones that we don't really have clear-cut answers to, but we will very, very soon.
Right.
Yes, we will.
Right.
I say shortly, and I combine it with soon. So.
Okay. Hey, we got to wrap it up, guys. I was reminded by Alexa. Bruce is over there whirling his finger around. So.
Yeah. He was behaving, I think it's because we had Melonie on, because usually Bruce is like yesterday.
I gave him a what? Some came flying through here. So.
Eric Asher was on yesterday, and he I don't know what happened, but I don't know if he thought he was cool because Eric was on and they correspond. But all of a sudden he throws something over, and that's what all those gifts are. Where is Bruce Brady? That you keep seeing come up because everybody's like, who's Bruce Brady? Who's this Bruce Brady guy?
We had fun, and we try to keep him under wraps as much as he does us.
But thank you for wearing pink. Thank you for being a strong CEO woman in the industry. Thank you for having me on here, Wayne and Bruce. I really appreciate the interview and the time with Affinity and Compassionate.
Thank you so much, Mel. We appreciated having you on. I beat you to it today, Wayne Kelly.
No problem. Hey, good time, great conversation. Hey, all right. Enjoy the day, everybody. This is Clinical Trial Day. Did I see that? What did you post online? I don't know the day. Yesterday. Okay, National Clinical Trial Day. Okay, yes. I'm blowing the takeout here. But everybody, thank you for listening to us another time. Melonie, thank you for coming on and sharing the story of CCC. We look forward to great partnership and research and data. And Dr. Donner, you folks are always there when we bring patients over to you. They thank you as well. Amazing stuff. Was that pretty good, C?
Yes, that's good.
All right. We're out of here.
And soon.
Take care. Thanks again.
Thanks. Bye.